casualty departments are set targets where they must see, treat and admit or discharge patients within 4 hours of arrival. Last year, Heartlands Hospital in Birmingham failed to reach those targets for the 3rd year in succession. NHS Local has spent a day in A&E at Heartlands to find out what their plans are for this year and what people can do to help reduce the pressure on their A&E by avoiding unnecessary visits.
The Accident and Emergency Department at Heartlands Hospital sees and treats about 120,000 people every year. During the winter they experience a massive demand, with sometimes over 350 patients visiting the department every day. Making sure that all of these people are effectively treated is the #1 priority for the hospital, but it's an enormous challenge at this time of year.
Our business in emergency medicine is dealing with crisis and difficulty all of the time. But the problem is a lot more patients are admitted during the winter than they are during the summer, which means that the department is under more strain in winter months generally. And obviously if on top of that we have a lot of other patients attending who could manage their condition elsewhere, that puts additional strain into the system as well.
Last winter, for example, the first day that we had heavy snow in Birmingham, we were presented with 20 or 30 fractured wrists, legs, hips, as well as the swine flu crisis that was going on at the same time. And this would mean we'd have over 100 patients in the department at any one time. And it was putting the whole department, indeed the whole hospital, under real threat of not being able to cope safely with the patients.
During the winter the department is regularly filled over capacity, and that makes it difficult in terms of assessing patients as you would want to. Sometimes, for instance, we've had difficulty in terms of being able to offload ambulance crews.
Coming up to obviously Christmas, etc., we can wait sometimes an hour plus in the hospital corridor in order to hand over the patients to the nursing staff. And while we're doing that, we can't go out and treat and respond to other people that may need us.
One of the major problems faced by the department is that more than 30% of people who come to A&E are being treated for problems that could be easily managed by their own GP. So the hospital is specifically targeting these patients and has a dedicated team to filter them away from the main A&E department.
It's the haematology registrar. I've trained as a general practitioner and worked in an accident emergency department for many years. What I do is I go around and find the patients who've got primary care problems who could or should have seen their general practitioner, and to deal with them and discharge them from the department. We'll monitor the computer screen, which will show us what the patient is presented with, look for the conditions that may have a primary care component to them, take them out of that stream and relieving the pressure on the accident emergency side of the department who are dealing with the seriously ill and the seriously injured. All these symptoms, your tiredness, your headaches, you're feeling generally rough, will start to settle. There's some more advice in the leaflet if you need it.
All right.
It's okay.
Yeah.
Thanks.
Thank you.
Thanks. Bye-bye.
Combined with this approach, Dr. McNamara and his team are educating patients about the other services that are more appropriate for their condition.
We're working with the local general practitioners at the moment to try and improve the services that we offer. I think part of it is people understanding and knowing the services that are available to them in the community. Some people don't know, for instance, that their general practitioners may be open extended hours, or for instance how to access the out-of-hours services, or that there's a local walk-in centre that could manage their condition entirely appropriately, or to use other facilities such as advice from chemists with regard to simple viral infections or very simple injuries.
It's really frustrating when you have patients coming in with primary care problems, simple coughs and colds, and potentially putting the people with more serious illness at risk of not being seen in time.
We will always manage anybody who attends the department, but it's a matter of people using all of the facilities available to them, so hopefully they only come to see us if they really need to. So often it saves them time if they use those facilities as well.
A crucial part of monitoring supply and demand is Heartlands' capacity management programme. Using this bed availability system means they can keep track of the predicted number of admissions coming into the department, as well as real-time demand for that day.
This document is a status sheet and it allows me to effectively plan the next 4, 8, 12 and 24 hours within the hospital. On a daily basis, we can expect to admit anything up to about 130, 140 patients a day. We currently have around about 650 beds on this site, and there is sometimes a disconnect between patients arriving during the morning in the afternoon to patients being discharged in the afternoon and into the evening. And it's actually matching the demand and the capacity to the discharge.
Emergency flows are often determined by information and information management. We can work on historic information which will show us what our admission pattern is like by day of the week, by month of the year. But we also work on live information, so we're looking at what it's like on the individual day. So that information at least gives us a heads up of knowing what our capacity requirements are going to be 4 or 5 or 6 hours down the line.
Today, for example, we need to find a total predicted admission of 85 emergency beds. We add on to that our elective list of patients who are coming in for planned surgery, and that would increase that figure to over 110 beds. At this present moment in time, we have approximately 45 beds available in the hospital, so I still have to find for the next 24 hours 65 more beds, but as this is a live document and it changes by the minute rather than by the hour, we will find those beds as we tend to do. But there are times where we can't actually fill the gap, and that is when we then increase the bed stock that we have, and we bring in extra nurses to support that.
With all these measures in place, Heartlands is confident it will meet this winter's targets for A&E. But it recognises that the public need to play their part in making the right choices for their care.
With the winter months coming along, all the NHS is going to be busy, but particularly the accident and emergency department. And when you've got 100 or plus patients in the department, you've always got to keep looking for the really sick patients who are sitting waiting to be seen. Treat them first and try and educate them afterwards.
The emergency department is here to manage patients, particularly when they're at their most vulnerable and when they've been injured or when they're very, very sick. And they are the things that we concentrate on and ensure that we do very well 24 hours a day, 7 days a week. We're working very hard with our local partners in the health economy to ensure that we meet people's overall healthcare needs. But I think it's important that the public are partners with us in this and that they use the services responsibly, flexibly and well.